Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal. And this is...
My name's Megan Abraham. I'm a physiotherapist here at the hospital.
What are we talking about today, Brad?
We are talking about exercises that you do in order to prepare for a total hip replacement, or prehab.
So today we're going to go over just a set of exercises that you can get started on prior to your surgery in order to prepare you for your total hip replacement.
Okay, now hang on, Megan. I've got hip arthritis. My hip hurts. How can I possibly do exercises? Is this not going to hurt?
It is going to hurt, but exercise is one really great way to ease that arthritis pain. Typically what I tell my patients is if you're experiencing pain that's about a 4 or a 5 on 10, that's okay as long as it goes back down to whatever your normal is within 24 hours after you finish exercising.
Okay, so for all my patients who tell me that they have a high pain tolerance, here's your chance to prove it.
And now, I really don't feel like doing the work. Is it important?
It's very important. The exercises that I'm going to show you today help to target specific muscles that are likely weak already as a result of having arthritis and pain and swelling. And they tend to weaken rather quickly after surgery as well, so it just helps you get prepared.
Increase your chances of success.
Exactly, yeah.
Okay, I'm going to go lie down.
Okay, perfect.
I'm going to squeeze behind you over here.
Mm-hmm. So the first exercise that we're going to do today targets your quadriceps.
It's going to be okay.
Your quads are the muscles that you have right here on top of your thigh. So what I'd like you to do is you're going to push your knee down into the bed, squeeze your thigh muscles, pull the toes towards the nose, hold for 5 seconds, and then you relax. Good. Let's do another one of those. Push that knee down, 2, 3, 4, 5, and relax.
Just making that muscle tight.
Exactly.
Okay.
Okay. The second one we're going to do...
Sorry, Megan, how many times should I do that?
Oh, good question. So typically what I tell people is aim for 5 to 10 repetitions.
Okay.
And you're trying to do that 3 times a day.
Okay.
Okay? The second one is also another exercise to target your quadriceps. So you're going to take a roll, and this isn't anything fancy. This is just a tin can covered in a towel. You can use a coffee can, apple juice can, anything that you have at home. So we're going to put this underneath the knee.
A cat?
A cat. I don't know if the cat would like that. You're gonna
Sorry, PETA.
You're going to push your knee down into the roll so that you're lifting this leg up like this. Again, you pull the toes towards the nose. You're squeezing your quads. You hold for 5 and relax down.
Okay.
Okay, let's do one more of those. Push that knee down, pull back, 2, 3, 4, 5, and relax down.
Okay.
Great.
So more quadricep muscle strengthening.
Exactly, yeah. So you'll see that that's a pretty important one.
And same thing, 5 to 10, 3 times a day.
Exactly.
Okay.
This third exercise, we're going to be working a different set of muscles. So now we're going to be working your glute muscles. And these are really, really important for good hip function after you have that hip replacement. So what you're going to think about doing is squeezing your bum cheeks together. So if you picture a $100 bill, you don't want to lose that $100 bill, so you squeeze those cheeks. Go ahead, hold for 5 seconds. And then you relax.
So is it safe to say you shouldn't eat Mexican food before you try
That's
this?
Yeah, that would be a really good thing not to do.
Sorry, Mexico.
I love Mexican
Me
You'd
food.
be
too.
offending a
Me
lot
too.
of people
For this
in this video.
exercise, it's
right.
probably wise.
Okay,
No
so
chickpeas.
5 to 10 times, 3 times
3
a day,
times
and
a
really
day.
just focusing on that contraction.
Yeah, now that being said, sometimes doing a really strong contraction like that can actually aggravate hip arthritis.
Okay.
So if you're finding that, just don't squeeze as hard.
Okay.
Okay, but it is still important to activate those glute muscles.
Okay.
Quads, glutes.
Exactly.
Okay?
Now the last one is just a nice range of motion exercise. So
Okay.
range of motion is just worrying about the movement of the hip. So for this exercise, what you'll do is slide your heel along the bed up towards your bum as far as you can go comfortably.
Right.
And then you're going to slide it right back down. Now it's obviously easy when you're doing it at home because you won't have your shoes on,
Right.
so your heels will slide nicely. And then up as far as you can comfortably.
And patients will often find that the higher that they start to bend their hip up, it starts to pinch or pull or grab, and that's why you're scheduled for a hip replacement. That's a big part of it. So do your best, anything you can do to help. Do you tell people to try to hook their hands if they can, or not really?
If they can, but at this point, because it's still arthritis, I
Sure.
don't want people pushing past the point of too much pain either.
Okay.
And sometimes with hips, this is quite a painful exercise, so
Sure.
you just do what you can, but it is important that you're keeping that hip moving.
I've seen patients use slider boards for that and
Yeah.
or throw a garbage bag on the table so it slides a little better. too.
Exactly, yeah, those are 2 really good options.
Excellent advice.
Okay, so we got quads, glutes, and range of motion exercises.
Yep.
That's all there is to it.
That's all it is. 4 exercises, 5 to 10 repetitions, 3 times a day.
That is all super useful information, and yeah, we want our patients to have the best chance of success, so this is the thing that you can do before the operation starts.
Megan, thank you very much for sharing that with us.
My pleasure.
And if you guys like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own quadriceps and gluteus maximus.
We'll see you next time.